Good morning, everyone. Happy Friday, and welcome to Pennie's Community Partner Work Group for February 2023. We're happy to have you, and thank you for being virtually present today. My name is Marie Ortiz, and I'm here to help facilitate today's session. For those who don't know me, my role here at Pennie is to help identify and fill operational gaps. It's truly a pleasure to present today's agenda, but first we're going to go ahead and cover some housekeeping items. This call is being recorded and conducted through MS Teams Live. If you'd like to forward to a colleague who is not present today or perhaps review the content later, you can do so at agency.pennie.com and click on Workgroup. And just while you're on the page, be sure to check out other resources that we have available to you. To limit background noise, all attendee lines are muted. We have Pennie team members monitoring the chat for any general or clarifying questions you may have. Customer-specific questions can be answered by Pennie's dedicated Assist Broker line, and that number is 844-844-4440. And there's a visual of the work group and where we keep the decks and recordings. We've also facilitated the URL on the slide for your convenience. Next, please. Okay, so today's agenda, we're going to cover community partner updates. We'll discuss operational updates involving DMIs, medical assistance unwinding operations, as well as communications. We'll talk about new functionality with respect to independence tax filers, and time permitting, we'll answer any questions and feedback that are in the chat. Next, please. So the update we wanted to provide today regarding the community partner update will be Pennie Board of Directors meeting, which is scheduled to take place next week, Friday, February 24th. The agenda is typically posted the week of the meeting, and this will be a longer session than usual due to discussions around strategic planning, OE updates, as well as plan certification policy, which should be finalized by the end of the meeting. We have facilitated the URL there in case you want to log in or go on the page and review the board of meeting materials, including the agenda and the meeting link. Next, we're going to cover some reminders, and we'll start with customer notice preferences. Next, please. All right, so regardless of whether people prefer paper or paperless notices, we just want to stress that customers can receive email and or text alerts when Pennie notices are sent. You know, working in operations, I hear about customers who did not read their notice or know to take action by a required deadline. And as you know, under federal regulations, we can't do anything to give them time back if they say lose APTC or lose their coverage. And for this reason, we want to remind you and encourage you to please speak to your customers about this option. And if people are not already signed up, talk to them to check the box. The screenshots you see here should be very familiar to you. The last slide was the initial screens that you see when completing the application. Under primary contact information, you'll see under email address, there's that box where you can check to send important alerts to that email address. And on the next slide, you'll see the screenshot of where to check the box to consent to receive the text messages, as well as any phone calls. The screenshot on the right just illustrates the communication preferences. The first option is for notices, and the second option there is for 1095A forms. Next, please. So if the application has already been submitted, you can still go in and check the boxes by selecting My Preferences from the customer's view and selecting the box under the phone number, as well as the box under the email address for those important alerts. Next, please. All right, so here we want to cover your inquiries, concerns, and escalations. As previously mentioned during last session, the Pennie Contact Center is the first line of defense, and there are times when a ticket needs to be created, and just want to provide you with like best practices, right? If a ticket does need to be created, be sure to provide the best phone number to be reached, as well as the best available time so that we could prevent that back and forth phone tag and be able to successfully reach you. If a ticket is open, be sure to note the ticket number, what it addresses, and just allow processing time. Here we have the processing times during OEP and outside of OEP. During OEP, allow 5 to 7 business days. Escalations taken between 3 to 5 days unless there is an urgent medical need. Outside of OEP, allow 3 to 5 business days, with escalations taking 2 to 3 business days unless urgent medical need is present. Just to note that Pennie does prioritize access issues or just any problems that involve, stopping a customer from enrolling. If you're on a call and you need supervisor intervention, just know that we have supervisors available and willing to triage and resolve your concern. If additional escalation is needed, you can always send an email to assisters@pennie.com if you're an assister, or brokers@pennie.com if you are a broker. Next, please. So the key message here is include specifics about the case, okay? So some examples, good examples would be, I submitted an attestation form for John Doe, application ID 23456 on February 5th, and I'm confused about the rejection. So seeing this, I have all the information I need to initiate my investigation. I know that this is regarding customer John Doe. I have the application ID. I know that you submitted a form, what day you submitted it, and I know that the concern is the rejection, okay? Another good example is Jane Doe, app ID 12345, called Pennie on Tuesday and said CSR Joe told her she's no longer eligible for tax credits. Again, I have all the information I need. I have the customer's name. I know that it involves a call that took place on Tuesday, who took the call, and the concern is about potentially not eligible for tax credits. Not so good examples would be the customer got bad information. Okay, what customer and what bad information did they receive? Or this form or letter is wrong. Okay, what form, what letter, which customer, and what is wrong? I tried submitting an application and it wouldn't let me. Okay, when, for what customer, and why didn't it let you? Like, did you receive an error message? Do you have a screenshot? Can you provide the steps that you took before receiving that stop? So on the right-hand side there, you see just examples of specific details that you should include, such as the customer's name, the app ID, ticket number if one was created, any relevant dates, if you spoke to a supervisor, their name, and just summarize the issue and your expected outcome. Okay, we really want to investigate your inquiries, concerns, and escalations, but we truly need that specific detail because hypothetical questions are just very difficult to answer. Next, please. All right, so here we want to talk about family glitch FAQs that we recently created and posted to the website. The one on the left talks about, can I receive financial assistance through Pennie if I can't afford my job-based coverage? And the one on the right covers, just provides guidance as to how to complete or answer that employee coverage detail section on the application. If you'd like more information about family glitch, we have covered this topic in prior sessions, and we've actually hyperlinked those sessions to the slide for your convenience here for September and December community work group sessions. Next, please. So here you see a screenshot of last month's Q&A document. So you had some really good questions in the chat during last session, and we've gone ahead and answered those questions and posted them to the website, specifically the agency.pennie.com under Workgroup. And those are just some of the topics there that you had questions about that we provided answers to. And we've also facilitated the URL there on the bottom of the slide, so you can click right into the document. And let me tell you, this document is very insightful. I've even learned some things, so I highly encourage you to go back and review and share with your colleagues, because sharing is caring. Next, please. Right. Now I am going to pass it over to my colleague, Hannah Turner. She's going to talk about data matching issues. Go ahead, Hannah.
Great, thank you, Marie. Go ahead and go to the next slide. So we've got a few updates related to DMIs. First is we did have a technical issue for a period of time in January that made it difficult for some people to upload some documents when trying to resolve DMIs. And this could be for any type of DMI. So you'll see the time period there. It was January 12th through January 31st when this issue was occurring. And folks would get this error message you'll see on the right when trying to upload their documents. The issue has been fixed. And so this is no longer happening. But because this issue was impacting some folks and making it difficult for them to upload documents during their reasonable opportunity period, we did decide that we were going to go ahead and extend the reasonable opportunity period for any people who still had an open DMI that during this period of time, so that we could make sure that nobody, lost critical time to resolve their DMI. So this has actually automatically been applied to any already in the system to any DMIs that were eligible. And this is the DMIs that will get this extension are going to be any unresolved DMIs that were open before 2/1. So if you just submitted an application yesterday, for example, that DMI wasn't open during the period of time where we had this issue, so it wouldn't get this extension. The extension is an additional 21 days. That equates to the amount of time where this issue was happening in production. So we want to make sure that we gave that much time back. The extension is available to anyone, regardless of whether they reported experiencing the document upload issue. We know some people reported it, some people may not have reported it. So we just made sure that anyone who could have been impacted is getting that additional 21 days. It is already reflected on the customer's DMI deadline. When you go look at their verifications page under actions required, this 21-day extension is already reflected there in the deadline. And customers will be getting a notice here shortly in their account, just letting them know that they did get some additional time, and we'll refer them back to their verifications page to check on the updated deadline date. We, of course, wanted to make sure that we did do this extension, of the reasonable opportunity period before any DMIs had expired. So no one was adversely impacted. Nobody had adverse action taken before we applied this extension. So everybody got the extension. Nobody was taking adverse action before they could have gotten this extension. So we did want to make sure you guys were all aware of that and that is already applied in the folks' accounts. Okay. Next slide. Now that issue we saw, that was applying to all DMIs. We do want to talk about another aspect of related just to income DMIs. So starting now through the end of the Medicaid unwinding, which we're going to talk a lot about more later, we are granting additional time for folks to resolve an income DMI. So essentially, they'll have a longer reasonable opportunity period for income DMIs only. It's going to go from 90 days to 150 days. And that basically is starting now through into early next year through the Medicaid unwinding. Basically means that every income DMI will be getting this additional time. It's not just customers who report a loss of Medicaid or something like that. It's actually all customers will be eligible for this additional time. That additional time, the 150 days instead of 90 days, is reflected on the customer's dashboard. So they will see that there as well on their notices. So you don't need to do the math and try to calculate sometime, deadline beyond what you're seeing on the account for either this or the extension, the little extension we talked about earlier. The deadline for the DMIs are what you see on the customer's account, and it already takes into account any extensions that they received, either because of the unwinding or that brief issue last month that we had. So this, again, the 150 days is income DMIs only, is not applied to non-income DMIs. And if the income DMI is not resolved by the end of the 150-day reasonable opportunity period, the customer will, as always, lose financial assistance, just like they would have prior when the reasonable opportunity period was only 90 days. So don't forget, we do have a lot more details on DMIs and resolving DMIs in our November 2022 and May 2022 work groups. We do have links to those below, so we can deep dive into both income DMIs and just all DMIs as well. Want more information? Next slide. So I want to talk a bit more about income DMIs and the document upload process, because I think you will see that there's been some changes to the user experience when you are uploading documents through the customer's secure account to resolve an income DMI. That happened recently, so we want to go through what that looks like. Basically, as you upload your documents to resolve an income DMI, you're going to have to tell us how much income that document represents. So as we'll show the screens in a bit, and that'll allow you to see sort of a running total of, based off of these 3 documents that you are trying to upload now, that represents however much income that you've now documented. And then we'll be able to compare that to, you see right next to that, how much income you report on the application. So you can see when you have provided enough documentation that matches the amount of income that you reported on the application. The reason we're doing this is, and we're really trying to help avoid some of the common pitfalls that we see that result in income documents being rejected the first time through. So one common issue is we see customers only uploading documents for just one person's income instead of the entire household's income. So this will help make sure that they know they are uploading documents that represent the whole household's income. It also reminds customers of what the income was on their application that they need to be able to verify their documents for. Sometimes people do their document upload immediately after submitting their application, but other folks take a lot of time and they may not realize that the exact amount they put on their application and realize that the documents don't match what they put on their application. So having that reminder there will help. And then again, showing them a running total of how much they've actually documented so far compared to how much was on their application, so that we don't get people submitting some documentation, but it doesn't represent all that they put on their application. And then lastly is really to help actually our team, so to help provide clarification to the Pennie team that's reviewing the documents, so that we understand what you are representing, what you think that document represents when you're uploading it. Sometimes it's really obvious, but a lot of times it's not, and it can be a little confusing. So take as a good example, like a pay stub. Sometimes we'll get a pay stub that represents, a 2-week period of time. Maybe the pay frequency isn't clear on there. Maybe they didn't make the number of hours worked clear, or the hours fluctuate. Having you provide, the annual amount of income that this document represents really helps us better understand what you are trying to show us with the documents, and helps eliminate some of just the confusion that can sometimes come from documents when we don't really understand what you're trying to show us. So our goal is the same goal as that you all have. We do want to increase the number of income DMIs where the documents are approved on the first time that they're uploaded. And that's really what this little additional bit of structure is really going to help address some of these common issues that we see. So go to the next slide and we can take a look at what this looks like on the account. So you'll see here on the right, one of an income DMI, and I've highlighted some of the key areas. So obviously at the top, the action required by date, that is the deadline for that particular DMI. Always pay close attention to that. Now you will see the total income that was reported on the application. It's listed as the stated income of, in this case, it was $44,000. And then as you upload documents, you'll see at the bottom, you have a running total showing you the total income documented, which is the sum of, how much income you say that those documents represent. And it'll be automatically compare it to the amount of income on the application and show you how much income you still haven't documented yet. And the submit button will prevent you from uploading documents until you have provided enough documents that you're pretty close to what was reported on the application. So let's look at how I got here to this end result. So click next. So we will start with, going with no documents uploaded. You'll pick the right document type from the dropdown. In this case, there's a pay stub. Upload the document, and in this case, this pay stub represents $20,000 of the annual income. So I'll enter the $20,000 and hit submit. Then you'll see that that document now gets listed below, and starts a running total. So there's the $20,000 of document income that I've documented so far, but that still leaves $24,000 remaining that I have not yet documented. So because I'm still far from what I put on the application, I'm not able to submit yet. So I need to upload another document. Go next page. Go ahead and upload another document. Again, that gets added to the bottom. This is, I think, Social Security benefits of $12,000 a year. Once I upload that document, it gets added to the bottom and my running total gets updated. Now it's $33,000, so I'm still short $12,000, so I'm still not quite yet able to upload to hit the submit button because I still need to do one more document. But once I add that third document, next slide, then we see that the running totals again. Now the last document was a pension document for another $12,000. That gets me to a total income documented of $44,000, which matches what I put on the application. I have no more income that I need to document, and I can now submit that. So it's really to helping the customer and you as you're uploading to make sure that you're submitting enough documentation, but this also gives a lot of detail to our representatives when they're reviewing the documents. So we know what you have submitted and what you think that income represents, and it will eliminate some confusion and hopefully be able to resolve these on the first try. So next slide. So we get this question a lot, and I think we've talked about it a number of times as work group, but it's important to reiterate here. What do you do if the documents you have don't add up to the total of what you have on your application? Or maybe the documents you have show a slightly different amount of income than what you have on the application. So for example, that maybe my pay stub represents working 40 hours a week, but I know that starting next month, I'm going to be working only 30 hours a week. So I don't have a pay stub yet that shows me working 30 hours a week, but what I put on the application is based on the change I know that's happening in the future to change those hours. So what I would do is provide my current pay stub, which is based off of 40 hours a week, and then I would attach a self-attestation form to that to say, the pay stub shows however much I'm making, but my application is based on only working 30 hours a week. My pay stub is based on working 40 hours a week. That's why the amounts don't match exactly, but you still need to include that pay stub showing the 40 hours a week with the self-attestation form. You should never just submit a self-attestation form. There should always be documentation that goes with the self-attestation form, and the self-attestation form can explain why the document doesn't match exactly what is on the application or something else. So an income self-attestation form, when it is submitted without any supporting documentation, it will be rejected. There's always some supporting documentation that can be provided. Okay. So again, if you want more on income DOIs and self-attestation forms, we spent almost the entire November work group on that and went into detail. Please go back and check that out if you're ever having any questions or issues, but wanted to re-raise that here just so it's fresh on everyone's minds. Okay. Go ahead and go to the next slide, and we can pivot now to talking about the medical systems Medicaid unwinding process. Next slide. So we, quick recap here. We've talked about this a little bit more detail last week, last work group, but as a refresher, make sure everyone's on the same page. Since the public health emergency went into effect in March of 2020, there's been a rule that says that Medicaid cannot disenroll anyone from Medicaid who enrolls after that period of time. That rule is going away. It is expiring. It's ending on April in April of 2023, and so that's what we're talking about is of the unwinding process. Is that now finally starting in April of 23, Medicaid will be able to redetermine eligibility for everyone who's currently enrolled in Medicaid and potentially disenroll people when they have not been disenrolling people for I guess almost 3 years now. This is back to March of 2020. So that's what we're talking about as the unwinding process. You may have previously heard us talking about it as the PHE unwinding process. This rule has been separated from the public health emergency, so now we're just talking about is the unwinding. So what this means is that starting in April of 2023, DHS is going to be using the next 12 months to do renewals for everyone that's currently enrolled in Medicaid. And it is spread out over 12 months. And we expect that there's a decent portion of people who are currently enrolled in Medicaid who will lose their Medicaid coverage during this 12-month renewal process. And some of those we expect to be eligible for coverage through Pennie. There's been a lot of work of collaboration and planning work between DHS and Pennie, along with the Medicaid issuers, QHP issuers, really trying to make sure that there is a smooth process for those folks who are going to be losing Medicaid, that they have a clear path for how to get coverage after losing their Medicaid. So we're going to talk about that here in a bit. Resources, if you are not yet signed up to for the DHS Helper site, you should do that. They are sending out really great alerts of new information. They have available FAQs, resources. We'll talk a little bit about some of their resources that are going to be really helpful. We also have information on the Pennie site under pennie.com, learn loss of medical assistance coverage. And you can even go and see some of the old webinars that DHS has done on this topic. So today, go ahead, next slide. So for today, we are going to talk about the customer experience of MA renewals during this unwinding process. And again, remember, each member is going to have their own renewal date at some point in this 12-month period of time. It's not that everyone on Medicaid is having their eligibility redetermined on April of 2023. It'll be at some point during that, between April of 23 and March of 2024. So today we're going to talk about the communications that the customers are going to get before their renewal, what the renewal determination results could be, those different possible outcomes, and compare sort of the different ways that someone may lose their Medicaid coverage and what that means. Next month's work group, we're going to focus more on what happens when those folks get onto Pennie and are doing their plan shopping through Pennie. There's a lot of special rules around their SEP, and we'll go into that in a lot more detail. But so for today, we're focusing on how they even get to that point. So how are they getting their renewal and what might be their outcomes? Going on to the next slide. So the Medicaid renewals will start. Customers will start to get their communications around 90 days before their renewal is due. And that's going to be a message telling them, hey, you're going to have a renewal coming up soon, and please come in and update your contact information. That is one area that there's a lot of concern about, is that there's been people who've been enrolled on Medicaid for several years now and may not have kept their contact information up to date. So if you all work with folks who are currently enrolled in Medicaid, that's a message you can start getting out to them now. We definitely want anyone who's enrolled in Medicaid to get their contact information updated so that they will receive these communications about their upcoming renewal. Really important. So there'll be some communications there about 90 days out prior to their renewal due date. 60 days before their renewal due date, they'll get a message, encouraging them to go ahead and do an early renewal. They can do it a bunch of different ways, through Compass, through the phone, in person at CAO. And that really helps them to get their renewal processed early and timely. And so they'll have a determination more quickly, I guess. But for those who don't do the early renewal, 30 days before their due date, that's when they'll get the, renewal packet. Says, hey, you've got to complete this renewal now. It will do 30 days from that notice. So there will be communications coming in a lot of different, through a lot of different methods. And Kelsey's going to talk a bit more about communications in a bit, but they will be getting communications through email, postal mail, and those are probably the usual methods of communication that we've been using, but we will also be doing a lot of communications through text messaging and phone calls, because we really want to make sure people are aware and using all different options to connect with these folks. The DHS site has a wonderful resource of all of the different member communications. So you can go look and see what email is going to be going out 90 days before renewals are due, and what exactly does that look like. You'll go in and be able to see the text message alert that goes out at 60 days before, encouraging them to do an early renewal, whatever. And so that's one of the things we want to make sure that everyone has a really clear picture of what is being communicated to these Medicaid current members as their renewals are coming up, and that we're all using the same language. If you all are working with Medicaid members, because their renewals are going to be spread out over this 12-month period of time, it'll be really good for you to get familiar with these communications. So if someone contacts you and says, hey, I got this text message saying I need to update my contact information because I'm going to have a Medicaid renewal soon, what does that mean? You would immediately be able to say, oh, I know that must mean they're 90 days out from their renewal date if they're getting the contact info message. And so it'll help give you some perspective, because they might not fully understand what their renewal date is. And you may have people at various different points in time in their renewal. So definitely should check that out if you haven't already done so, and bookmark that. It's a great resource that's being constantly updated. So let's look at what these timelines look like for a sample renewal date. Go ahead and go to the next slide. So let's say we have someone whose renewal is in May. So their renewal is due approximately May 15th. If we back up, that means that they're going to get their first communications pretty much right about now, saying February 15th would get their 90-day prior notice. That's the, hey, update your communication information notice. Around March 15th is when they would get their early renewal messages, and then around April 15th is when they would get their, hey, you need to complete your renewal now message. That would be all for the May 15th renewal due date, and then the renewal determination would be done by the end of May. So that would be an example of how the timeline would look for a May 2023 renewal. So go to the next slide. So now we've talked about what it's going to look like, how they're going to know that their renewal is coming up and when their renewal is due. Let's talk about the actual outcomes of their renewal determination. And there's 3 different potential outcomes that folks may have. And they're going to depend a little bit on what they did in response to those notices beforehand. So did they complete their renewal? And by that completing renewal, meaning did they submit the renewal packet and all the information necessary back to Medicaid by the due date? So first outcome, click next, is that the customer submitted their renewal packet and Medicaid reviewed and found, yep, they are eligible for Medicaid and or CHIP. And next, they're just going to continue their enrollment in Medicaid. You may see some kids who move from Medicaid to CHIP. They may have been on Medicaid because of the continuous coverage requirement, who may roll off of Medicaid and into CHIP, but that's a pretty smooth coordination process that happens there. Okay, so that's the kind of happy path. There will be plenty of people in that bucket. It's not like everyone is going to be losing their Medicaid coverage. Lots of folks will be in that bucket. But we're going to be focusing on these second and third possible outcomes. So for the second outcome, next, this is where the customer, again, submitted all their renewal materials in, but the outcome was that they were found to be no longer eligible for Medicaid or CHIP. So that means next that they're going to be losing their Medicaid coverage. And that's new, right? Nobody's been losing their Medicaid coverage since March of 2020. And these folks will lose their Medicaid coverage, and DHS is going to send their application to Pennie to check and see if they might be eligible for APTC or CSR. Okay. So that is one population that we are focused on as that second population. The third possible outcome, and we'll dig into that one in a minute. The third possible outcome is you're gonna have some people who just don't respond and don't complete their renewal packet. Maybe they didn't get the notices because they didn't update their communication information, their contact information, or maybe they just didn't really understand what they needed to do. Either way, if they don't complete their renewal by the renewal due date, then they are going to get an MA closed result. That's their eligibility, which is really, they're not found eligible, but they're also not found ineligible. This third outcome is that they were not able to determine their eligibility because they didn't have the information to make an eligibility determination. So I know that sounds a little bit nuanced, but it's important because next they're still going to lose their Medicaid coverage. Next, Kelsey. And so you'll see they'll lose their Medicaid coverage. So you'll have people who are losing Medicaid coverage. They might be losing their Medicaid coverage because they're in bucket 2, where they were found ineligible. But they might be losing their Medicaid coverage because they didn't respond to their renewal packet and their MA was closed. There are different pathways for those folks. So even though they've both lost their MA coverage at the end of their renewal process, the reason for why they lost their coverage has an impact on what they need to do next. So let's dig into these two outcomes and what it looks like for them. So go to the next slide, and we'll look at the second bucket of folks. These are the ones who submitted their renewal, were found not eligible for Medicaid or CHIP, lost their MA coverage, and were sent to Pennie to determine their eligibility for APTC and CSR. So when these folks get their MA determination notice, it's going to telling them that they are no longer eligible, they're losing their MA coverage. It's also going to tell them that that their application is being sent to Pennie to determine if they're eligible for coverage through Pennie with financial assistance. So on the back end, DHS will be sending those applications with that updated information from the renewal packet over to Pennie, and we'll also be receiving the customer's eligibility denial date. We'll take that information and do basically the same process we've been doing for the last year, where we will take that application, submit it through Pennie, and automatically generate an eligibility determination for them for coverage, for QHP coverage through Pennie, with or without APTC and CSR. The majority of the applications that we receive from DHS, we are able to immediately generate an eligibility determination for them through Pennie. There are some still, though, where there might be a piece of information missing or something where we're not able to generate their eligibility immediately. For those folks, we just pre-populate an application and tell them, come on in, review it, and submit it, and then you'll get your eligibility. So the majority are getting there just immediately. We're able to determine their eligibility. And so then the first notice that these folks are going to get from Pennie is a notice that says, hey, we received your information from Medicaid because you lost your coverage through Medicaid. You are eligible for coverage through Pennie with, XYZ amount of savings, and here's how you can come in and enroll in a plan through us. The other thing that we're able to do for this population is, because we've received all this information in their application from Medicaid, we're also able to automatically apply an SEP for loss of Medicaid for these folks, because part of the application and information we're getting from DHS includes the person's coverage end date, the MA coverage end date. So for these folks, their application is sent to Pennie automatically. Automatically, we're going to determine their eligibility and automatically grant them an SEP. So all they really need to do is create an account and pick a plan. That's one step that we can't do for them, but everything else has been handled for them. So let's compare this experience to the other folks who are losing their Medicaid that were in that outcome number 3. So for these folks, a reminder, they did not complete their renewal packet for some reason, and so their MA was closed, no eligibility determined either way. So their MA is also terming, but their notice that they get will tell them, hey, your MA coverage is ending. You have two options. Essentially the two options are they can go and submit a late renewal to DHS to reconsider them eligibility for Medicaid, or they can go and apply directly to Pennie. So we've worked a lot with our colleagues at Medicaid on making sure that this message on this notice is really clear, because the key thing is that for these folks in outcome number 3, their application information is not able to be sent directly to Pennie. These folks are going to have to take action based off of their termination notice in order to get coverage somewhere. That could be through Pennie. It could be by going back to DHS and getting a Medicaid determination there. So this is an area that we've focused a lot on in planning on. They're going to get extensive amounts of outreach after their MA is terminated to say, like, make sure that they understand what the process is, how they can get coverage, and what action they need to take to get coverage. There'll be a lot of communications there. There's been a lot of coordination on consistent messaging on that, and that's why I think it's helpful if you go look at those sample communications to see what that wording looks like and what they're going to be hearing from different sources. Let's say this person then does eventually come in and apply through Pennie. Their application process is going to be a little bit different. One, they're going to have to complete the application. We don't have their application pre-populated for them. And a really important thing is that these folks, even though they lost their MA coverage, they were not found ineligible for Medicaid. So when completing the application, there's a question that says, were you recently denied Medicaid or CHIP in the last 90 days? These folks should not put a denial date in there because they were not found ineligible for Medicaid. Even though they lost their coverage, they weren't ineligible for Medicaid. So, and that's important because when they fill out their application, they may still be eligible for Medicaid. And if that's the case, we're going to send them to Medicaid so that Medicaid can do a determination and potentially enroll them. But they should not say that they were denied because they were not denied. Their coverage ended, but they weren't denied. Okay. Also, let's say once these folks do, if they are eligible for coverage through Pennie, they're going to have to actively report their loss of Medicaid, SEP, because again, since we aren't able to sort of automatically process and receive their application information, nothing's sort of pre-populated for them. So we focused a lot on making sure that communication is really clear, but you can see that there's two very different experiences, whether you're in losing your MA coverage in outcome number 2 or losing your MA coverage in outcome number 3. Next slide. So we've got a little side-by-side comparison here of what these two outcomes are, because in both cases, they are losing their Medicaid coverage at their renewal, but there's different, impacts. The key thing being sort of the automated flow into Pennie that happens in outcome number 2. And then in outcome number 3, these folks are going to have to take proactive action to either go back and do a late renewal with Medicaid, apply through Pennie. They're going to potentially be very confused about whether they were denied Medicaid or not. And I think so there's a few additional points of confusion potentially for that third population, that outcome number 3 population. Okay. So hopefully this will be a good comparison for you as you are thinking about the unwinding and remembering that just because somebody lost their MA, you really need to know which of these two paths they're in. And so it's going to be really important that you understand the communications to be able to identify which path they're in, so you know what steps that they need to be taking. So I'm going to hand it over to Kelsey, who's going to talk a bit more about the communications aspect of the unwinding.
Yes, thank you so much, Hannah. Just a reminder, my name is Kelsey Cameron. I am the Communications and Marketing Manager here at Pennie. So I'm just going to touch a little bit on the communications we're going to be sending to those two impacted populations that Hannah just mentioned from the Pennie side once the data has been shared. Like Hannah said, the two populations are those who have responded to the renewal packets and are found ineligible, so their account has been transferred over to Pennie, and then those who do not respond to the renewal packets and are losing coverage. We're calling that second group the procedurally terminated population. So for the first group, the MA renewal and eligible account transfers, like Hannah mentioned, we're going to be sending them a notice about their Pennie account that has been created on their behalf. And this notice will include their account access code, the estimated eligibility redetermination based on their income, that information that was provided by DHS, and then the date of their special enrollment period. A couple weeks following this notice, we're going to be also sending them emails, a few emails as reminders, and then also conducting outbound calling with the messaging to log into their Pennie accounts, check out their plan options, and enroll in coverage through Pennie. And then for that second group, the procedurally terminated population, the first thing that they're going to get from us was going to be, like Hannah mentioned, that that mailer, which is going to be co-branded with DHS and CHIP and Pennie, with details on who Pennie is and how to enroll. Following that mailer, we will also be sending emails as well as outbound calls to remind them of their coverage options through Pennie. And just to quickly touch on some other communication efforts that we're working on now through Pennie, our owned media. We have I think Hannah mentioned this earlier too. We have a Pennie specific unwinding webpage at pennie.com, and that just has some high level details, a pretty decent explainer video, as well as FAQs. We are going to be conducting a pretty robust social media campaign to help spread the word. We will also have a stakeholder toolkit. There's actually going to be kind of two different toolkits. There's one currently that is at the DHS unwinding webpage that you can find, that has a lot of Pennie information in there. But then we're also going to be creating a Pennie specific toolkit with Pennie collateral materials, social posts, and digital graphics that can be shared. We will be sending a link out to that toolkit closer to the April 1st date. And moving on to paid media, we have a full advertisement and media campaign to reach those using medical assistance, and that can be where their options. This campaign includes multi-channel marketing strategies like television, radio, billboards, transit ads, digital ads, social media, streaming platform, among others. We're really going to be focusing towards reaching non-English speaking and multicultural media partners. DHS and Pennie will be running separate media buy ads, but then also co-branded assets to make sure we're having a consistent messaging. Earned media will also be working in very close coordination with DHS to conduct press conferences, distribute press releases, and we're working on a pretty robust media campaign throughout that will cover the entire 12-month period. And we also have a pretty robust outreach campaign to help build awareness with a lot of grassroots outreach events, especially through our YMCA Health Equity Tours. Overall, our messaging and marketing goals are to introduce Pennie to this impacted population. When this was all under the public health emergency, the public health emergency was created during Pennie's implementation. So we are aware that there's a good chance these people who have been on medical assistance this whole time have never really needed to know who Pennie was before. So we're really keeping an eye on that into our messaging and introducing Pennie to a new population. So I know there was a lot of details on the unwinding presented today. We will be distributing stakeholder talking points, which has this all in more of a talking points document that will be shared in the near future. All right, and then I think I'm moving it back to Hannah.
Yep, thanks, Kelsey. Before we move to the next section, I mean, I want to make sure folks understand, like, we're going to be talking a lot more about the Medicaid unwinding process. And like we said, in the next session, we're going to talk more about the process once they're on Pennie and applying the SCP process, et cetera. You know, we're probably in this forum not going to talk about the nuances of how Medicaid eligibility is determined at renewal. But we're going to focus on what these folks are going to be hearing, responding to notices, and then what their outcomes are going to be and how they get coverage, especially for those folks who are losing MA. So please stay tuned to these work groups for more information and sign up on those resources so you can get these updates when they come out, including things like our stakeholder talking points and toolkits and things like that that Kelsey mentioned. It's gonna be a pretty big initiative over the next little over a year, and we really want to do everything we can to make sure that folks have a smooth transition from Medicaid to wherever it is that they need to get coverage. Last topic we wanted to talk about today is about some new functionality we have that allows for children who are under 26 to be able to enroll with their parents, even if that child is their own tax filer. So we call these children independent tax filers, or ITFs for short, because we of course need more acronyms. So going to the next slide, let's talk about what who these folks are. So these independent tax filers are people who are a child of their child who is under 26. So under the age 26 rules in the ACA, they should be allowed to enroll with their parents. However, because they are their own tax filer and they're not a tax dependent of their parent, up to now they have not been able to do that through Pennie, and actually through the FFM and through most state-based marketplaces. They're not able to do that because in the individual market, your eligibility is based on your tax household. That's why when someone completes their application, they put everyone who's in their tax household on their application, all the income from their tax household. It's a tax credit that ties back to everything with their tax household. And this scenario where you have a child who's under 26 but is their own tax filer, you now have two separate tax households. The parents have their own, we call them the primary tax filers, and then their child, who is their own independent tax filer. They are not normally able to be on the same application together because two separate tax households. But if they want to enroll in a single health plan together under the child age 26 rules, they previously had not been able to do that. They can going forward. So we're going to talk just a bit about this, and they're going to be mostly keep some of this information available for you in the future so you know how to access this when you come across this scenario. This is not you're not going to have thousands of these cases coming to your door, but we want to make sure that you're aware of who these folks are and what they can do now through Pennie, so that you can come back and reference this later when you have an application. It's actually a lot more straightforward than it sounds. It just sounds complicated because eligibility is by tax households and it gets messy. So again, the purpose for it is so that we can have children who are under 26 be able to enroll with their parents when that child is in a separate tax household from their parents. Okay. So I think the best way to do this is, let's look at an example on the next slide here. I've got an example on the left of an application. It's going to have 6 people on it. And so I've got 2 parents, and those 2 parents have 2 children, conveniently named child and child ITF. So the one child is the dependent of the parent still. So those first 3 people are in a tax household together. The other child is under 26, but is an independent tax filer. And in fact, they are not only an independent tax filer, they have their own spouse and their own child. So we have now one application that has 2 distinct tax households on it. We can see on the right. Right. Go to the next slide. The purpose of this is that we want the independent tax filer child, called child ITF, to be able to enroll in a policy with the parents and that dependent child. So in order to have that application enrollment, the enrollment together of those 4 people, as you see on the right, you have 2 people that are parts of 2 different tax households who want to enroll in one policy together. That's what this functionality allows us to do. Now, even though that adult child who's their own tax filer, they have a spouse and a child on their own tax household, that their spouse and child are never going to be able to enroll with their parent. Just isn't allowed. That's not what the age 26 rules require. So if this adult child who's an independent tax filer, if they need coverage for their own spouse and their own child, they should not follow this independent tax filer process. They should just go and apply with their own tax household like they've been doing up to now. But let's say that their spouse and child don't need coverage, and it's just the independent tax filer child who's under 26, and they want to enroll on the same policy as their parents. Starting now, they're actually able to do that through Pennie. And so Go to the next slide. Really, the key thing here is, I'm not going to go through all of this. The key thing, a real chart that compares the current most common applications, which is the ones you're used to now that have one tax household on the application. That's the middle part of the chart. The right is when you add an independent tax filer to that. So now you have one application with 2 tax households on it. The key differences here, just to highlight, are eligibility is separate for the separate tax households. So APTC will be separate for the primary tax filer's household from the independent tax filer's household. So you basically have one application, but we're doing 2 separate eligibility determinations and we're splitting the people up by tax household. That APTC is a key one there because we then have to make sure that the different tax households are not using one another's APTC. So the primary tax filer can't use APTC from the independent tax filer's APTC to pay for their premiums. Because at the end of the year, each tax household is going to get their own 1095 because each tax household has to reconcile their own APTC. So eligibility is kept completely separate through a lot of mechanisms behind the scenes on our part, and which is honestly why a lot of the other exchanges haven't done it. It's rather complicated to do on the back end, but from the front end, it's actually relatively straightforward because we're keeping track of everything on the back end. So APTC will be separate. You're also going to have potentially income DMIs, right? Income DMIs are used to only having 1 per application, and it's really 1 per tax household because we're looking at the income across the whole tax household. So if you do have an independent tax filer on the application, you might have 1 income DMI per tax household. So, you will see a few different nuances because you have more than 1 tax household on an application compared to when you only have 1. So we're getting short time. Go ahead and click through. We do have, next slide, we go into more detail about how each aspect of eligibility, enrollment, and everything is different and is kept separate when we have independent tax filers. You can go and go to the next one. And then, like I said, the 1095s, they're going to get separate 1095s. They can put a different mailing address for their 1095s, so the ITF will get their own 1095 mailed to them. Go to the next slide for me. This is, in order to actually use this functionality, like I said, it's actually relatively simple on the front end. All you will do is when you are doing the application, you put everybody on the application, do the relationships, and then when you get to the question about tax households, who's filing taxes, you would just indicate everyone who's filing taxes. You would now potentially have more than just the primary tax filer filing taxes. Once you complete this question, the system will look and say, okay, you're showing more than 1 tax household on this application. Is that allowed? Is this because the other tax households are for children under 26? If they are allowed, you'll get a pop-up that says, hey, yep, we see that we've got an independent tax filer on here. They're going to be eligible to enroll. They'll get separate eligibility, separate 1095s, but you can go ahead and go forward. Okay. That's really the only thing that you're going to see different in terms of what you have to do differently when you're completing these applications. Is it'll happen here when you're answering the questions about who's filing taxes. You can go ahead and go next. We'll skip ahead here. You will see like the eligibility will be split out separately on the dashboard and in the notice in a few different places to help provide clarity. Go ahead and get next. And go ahead next. I did want to just do a quick reminder of the child age 26 eligibility rules. This has not changed, but it's always good to refresh this because we don't refresh it quite often enough. And it is a little bit more nuanced. It's not just children are eligible through the end of the calendar year in which they turn 26. So children don't age off when they turn 26. They don't age off on their birthday. They don't age off at the end of the month. They're eligible through the end of the year in which they turn 26. The other way you can think about it is, what's their age on the last day of the calendar year? If they're 26 on the last day of the calendar year or less, they're eligible to enroll at any time during the year. If their age as of the end of the year is 27 or more, they're too old, they can't enroll as a child. Okay. And we've got examples here that you can look at later if you want to kind of show some of those nuances. of what their age is when they're applying, what their age is at the when their coverage starts. That we often get some of those questions for people who are just turning 26 or and confusion about whether they are eligible to enroll or not under the age 26 child rules. So this will be here for reference along with the other slides that we sort of skimmed over here, for when you do have a scenario where you have one of these children who's under 26 who is their own tax filer, and you want to enroll them together in the same health plan through Pennie. You are able to do that. Check out, go back and reference this material so you can make sure you understand the differences and how their eligibility will be kept separate, but they'll be able to enroll together. Okay. And I will next hand it back over to Marie for a wrap up at just 1 minute long here. Apologies for that. It's all yours, Marie.
Thanks, Hannah, and thanks, Kelsey, for your presentation. Today, this wraps up today's presentation, but before ending the session, we do want to let you know how you can help. You can help by sharing Pennie posts on your social media platforms, providing education about ways to enroll in coverage, communicating changes or call to action items to your customers. As far as programs to communicate to your customers, we have the Path to Pennie, which is happening now during tax season, the income qualifying life event for those who have equal to or below 150 FPL, and of course, coming soon, the medical assistance unwinding, which we've been covering in these sessions. Next, please. All right, so questions and feedback are always welcome. Do you have a topic that you wish to have presented, or maybe you're seeing patterns and you think it would be beneficial for us to present a specific topic? Feel free to send us our way. We're always, again, welcoming the feedback. As a reminder, like we did see, we answered questions in the chat, but want to remind you that the content, so the deck, the recording, and the Q&A session document will be posted on the agency.pennie.com under Workgroup for your reference. Thank you very much for your time, and we wish you a great day. Take care, and until next month. Bye now.